Our next guest, I am really delighted to welcome, is Margaret Cooper, who is a patient in Northern Ireland, who is going to talk to us about being on a clinical trial.
Good morning, everyone. I think following on from Professor Mead's fascinating talk, what I want to tell you about my experience on the clinical trial will show you the value of being involved in trials. So, Prof McMullen asked me to speak about the trial that I have been on recently, and what I thought I'd do, just to keep it nice and short, is I'd break it down into 3 short sections. Firstly, I'm going to tell you a bit about myself, how I came to be on the trial, what it involved, and finally how it went. So my background is I'm a retired tribunal judge, and I live in the west of Northern Ireland in County Fermanagh, probably a place that most of you have not heard of. I was diagnosed with ET 14 years ago, and for most of that time, my situation remained stable. I went up and down to the City Hospital in Belfast, but about 3 or 4 years ago, things changed and I developed PV. In early 2022, I wasn't feeling very well. I was having spleen pain and losing weight. And after investigation, I was diagnosed with myelofibrosis in February of last year. Until that time, I'd been treated with hydroxycarbamide, but I was then put on ruxolitinib. And during the following year, I continued to have quite a bit of spleen pain and wasn't really doing all that well. So at the end of the year, Prof McMullen suggested to me that it might be a good idea to go on a clinical trial. And really, it's my experience of what happened next that I want to talk to you about. Once the trial was mentioned as a possibility, I had a detailed consultation with Prof McMullen and a nurse from the clinical trials team. The trial is called the PROMISE trial, and it was developed under the sponsorship of the University of Birmingham. The purpose of the trial is for people like myself who have either intermediate 2 or high-risk MF, but are not seeing much improvement with ruxolitinib alone. Dear me. So the idea was that I should take a drug called PLX2853 with the ruxolitinib, with the plan that this might help with spleen size and also have a positive effect on the disease. So obviously the suggestion of a clinical trial was quite nerve-wracking, and there were a few things that I felt I had to consider. So I'm just going to run through what I felt myself. First of all, and my main concern was it going to be safe? What did the treatment involve? What would the side effects be? And how long would the trial last? I was given a lot of information by the medical team and a very detailed information booklet. I had a bone marrow biopsy and an ultrasound of my spleen to see if I met the detailed criteria. So after all this was looked at, I did meet the criteria to go ahead, and I decided that I was under no pressure to continue. Nothing was hidden from me, and I was happy to go ahead with the trial. So I suppose the main thing then is what happened next. Well, the treatment just involved taking 2 tablets daily with my ruxolitinib, and it was structured in 8 21-day cycles. But there were a lot of hospital visits during that time. I knew in each cycle how many visits I would require, and I have now completed the 8 cycles of treatment and actually remain on the medication at the moment. So what would I say about my experience? Most importantly, I've had the opportunity to take part in a trial of a drug which isn't readily available yet. I've had excellent care from my medical team and from the clinical nurses. I'm able to contact the team at any time if I have any concerns, and I feel that the whole procedure has been very reassuring. I've been very pleased to have the regular monitoring. I've had a lot of extra blood tests and some bone marrow scans and a couple of extra bone marrow biopsies, but I've been pleased to have all that done, and it's been very reassuring for me. The only one issue for me has been, which won't apply for other people, is that I live 90 miles from the hospital. So I've had a lot of travelling to attend. The attendances are quite long days by the time you have your bloods done, consultation, wait for the prescription. But I would happily do it all again because it has been very valuable for me. So what would I say about the overall experience? I'm probably repeating myself, but I do feel that I was completely satisfied that I was given all the information I needed before I started. I was well aware medically what was involved, and I had excellent care. So really there were no downsides for me in being involved in the trial. Obviously, I'm not going to stand here and say to you, if you're offered a trial, definitely go on it. But I would like people to take away from this, don't write it off without considering it. I think we could see quite clearly from Professor Mead's talk the value of trials, and every treatment that we've been on has been started with a trial. Always remember, our doctors have our best interests at heart. You will benefit from the extra monitoring and support and the opportunity to try medications that have not yet been available. I've been fortunate. For me, the trial has been successful, and I really feel that it's only through the involvement in trials that our treatments have come this far, and hopefully, as we've seen, progress further in the future. So that's really the message that I wanted to get across to everybody. But just in conclusion, I would like to thank Nona for asking me to come along today, Maz, who's at the back of the room keeping me right, MPN Voice, which I think we must all agree is an excellent organisation and gives us all fantastic support. But finally, I'd also like to thank Professor McMillan and my team, who have been completely supportive of me all the way and have been very valuable to me. And finally, I'd like to thank all of you for listening to me because I've been quite nervous.